Every second counts when you're staring at those squiggly lines on an ECG strip. One wrong interpretation could mean the difference between life and death. Today, we're breaking down myocardial infarction ECG patterns, specifically what you need to know for NEET PG and FMGE exams, the most common pitfalls to avoid, and how to approach these questions with confidence.
And this isn't just about passing an exam, this is about saving lives. When you're looking at an ECG of a potential heart attack, you need to know exactly what you're seeing.
Let's start with the basics. What exactly are we looking for in a STEMI?
Well, according to recent guidelines, we're looking for ST segment elevation at the J point in 2 or more contiguous leads. For V1, V3, men over 40 need at least 2 millimeters elevation, while women need 1.5 millimeters.
Wait, different criteria for men and women?
Exactly. And for all other leads, we need at least 1 millimeter elevation. But here's what many students miss. These numbers are just the beginning.
What do you mean?
Well, you also need to look for reciprocal changes. In an inferior MI, for example, you'll often see ST depression in leads I and AVL while having elevation in 2, 3, and AVF.
That's fascinating. And what about NEETMI? How do we differentiate that?
NEETMI is trickier. You're looking for new horizontal or downsloping ST depression of at least 0.05 MV in 2 contiguous leads, or T-wave inversion of at least 0.1 MV.
You know what's interesting? I've heard that sometimes elevated troponins don't actually mean heart attack.
That's absolutely right. According to the 4th Universal Definition of Myocardial Infarction from 2018, we now recognize something called non-ischemic myocardial injury.
Can you break that down for us?
Sure. It's when you have elevated troponins but no evidence of myocardial ischemia. This can happen in conditions like sepsis or renal failure.
That must make diagnosis pretty challenging.
It does, and that's why the ECG is so crucial. You know, it's interesting how ECG interpretation has evolved over the years.
How so?
Well, we've gone from basic rhythm strips to high-sensitivity troponin testing and AI-assisted interpretation, but the fundamentals haven't changed.
Speaking of fundamentals, what are the most common mistakes you see students make on NEET PG when it comes to ECG questions?
The biggest one is not considering the clinical context. They'll see ST elevation and immediately jump to STEMI without considering mimics like pericarditis or early repolarization.
That reminds me of how medical TV shows always get this wrong.
Oh, don't get me started. They'll show a flat line and shock it with paddles. That's not how it works at all.
Let's get back to exam preparation. What's your advice for approaching ECG questions?
First, develop a systematic approach. Look at rate, rhythm, axis, then specific changes. And always check reciprocal leads. They're often the key to the correct diagnosis.
And what about timing? How important is that?
Crucial. The evolution of changes tells you so much. Hyperacute T waves are the earliest finding, followed by ST elevation, then Q waves develop later.
That's really interesting about the progression. Can you elaborate?
Sure. Hyperacute T waves appear within seconds of infarction. ST elevation develops within minutes, and pathological Q waves usually take more than an hour to develop.
And these timing patterns actually help predict outcomes, right?
Exactly. The faster the progression, generally the worse the prognosis. That's why the phrase, time is muscle, is so important in cardiology.
What about location? How do we determine which part of the heart is affected?
That's where lead groups come in. Elevation in 2, 3, and AVF indicates inferior MI, V1, V6 for anterior MI, and I, AVL, V5, V6 for lateral MI.
And posterior MI, that's often missed, isn't it?
Yes, because it shows up as ST depression in V1, V3 rather than elevation. You need to think mirror image.
Let's talk about some high-yield exam points. What commonly appears in NEET PG questions?
They love testing reciprocal changes and asking about the timing of biomarker elevation. Also, questions about distinguishing STEMI mimics are very common.
Any specific patterns they like to test?
The tombstone pattern or Pardee sign is a favorite. It's that massive ST elevation with terminal T-wave inversion you see in extensive anterior MI.
And that's particularly dangerous, right?
Absolutely. It indicates a large area of damage and high risk for cardiogenic shock and sudden cardiac death.
Speaking of risk, what about sinus arrhythmia? That shows up on exams too.
Yes, and it's important to distinguish it from more serious arrhythmias. It's just normal variation with breathing, showing variable RR intervals but normal sinus rhythm.
Let's talk about some practical tips for exam day. How should students approach an ECG question?
First, don't panic. Take a systematic approach. Rate, rhythm, axis, then look for specific changes. And always consider the clinical context provided in the question.
Any time-saving tips?
Look at lead 2 first. It usually gives you the most information. Then check the reciprocal leads. Don't waste time counting every little box if you don't need to.
What about memorization? There's so much to remember.
Focus on understanding patterns rather than memorizing numbers. If you understand why ST elevation occurs, you'll remember the criteria better than just memorizing 2 millimeters versus 1.5 millimeters.
That makes sense. Any final advice for our listeners?
Practice, practice, practice. Look at as many ECGs as you can. And remember, every ECG tells a story. You just need to learn how to read it.
And what about resources? Where should they practice?
Previous year questions are gold. The NEET PG papers from 2018 to 2025 show consistent patterns in how they test ECG interpretation.
Any particular topics they should focus on?
Master STEMI criteria, know your mimics, and understand the progression of changes. Those 3 areas cover most of what you'll be tested on.
And always consider the clinical context, right?
Exactly. The ECG is just one piece of the puzzle. You need to integrate it with symptoms and biomarkers for the full picture.
What about common distractors in exam questions?
They love to throw in early repolarization or pericarditis as STEMI mimics. Also, watch out for questions about right ventricular infarction.
Why is right ventricular infarction special?
Because it requires additional right-sided leads to diagnose properly, and it changes how you manage the patient. They can't tolerate nitrates like left-sided MI can.
That's a great point about management differences.
And that's why understanding the underlying pathophysiology is so crucial. It's not just about pattern recognition.
As we wrap up, what's the one thing you want our listeners to remember?
That every ECG you interpret could be someone's life in your hands. Master the basics, understand the patterns, and always stay systematic in your approach.
And remember to check those reciprocal changes.
Absolutely. They're often the key to the correct diagnosis, both in exams and real life.
This has been incredibly informative. Any last words?
Yes, time spent mastering ECG interpretation is never wasted. It's one of the most important skills you'll ever learn in medicine.
Well, that brings us to the end of today's episode of Copilot Podcasts. Remember, those squiggly lines aren't just exam questions, they're windows into the heart's story, and you're learning to be its interpreter.